Hello, my name is Harald Ringdal, and I'm here to do my presentation for the Sport and Exercise Medicine module, module 5. This is Marianne. She will be my patient today, and we will start with the assessment of the ankle. So the first thing we do is that we start with the observation, general observation. And we have a look here, and I bring the camera down to the feet. There. And we can get a general overview of the longitudinal arch, the transverse arch, the alignment between the knees and the ankles and the hip. We can look for swelling, and we can look for the general overview of how it looks. If you take a look sideways, we can get also an overview of how the ankle stands in relation to the rest of the body. And if you turn around, we can have a look at the position of the feet, if there is pronated or supinated, if there is any bowing of the Achilles, the weight shift of the body, if there is any atrophy anywhere in the legs or in the thighs, if there is any toe signs. Can you go up on toes, tiptoe, and we can get a general overview of the neurological function and the function, and down, and walk on your heels. There, good. And you can walk up, walk a bit just normal up and down. Good. And you can sit there. Then we can get a more general overview of the ankle movements. If you lift your feet up, down, in and out. Good. After this, we can get a more thorough inspection of the feet. If you sit further in on the bench, a little bit more. There. 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 See if we can get some good image. Okay. It could be good to start divide the ankle into different regions and start with one plane at a time. The first thing that I would do is just to look if there is any dangerous signs, for example fracture, and I would start with the Ottawa criteria, for example. And we could palpate behind the malleolus to look for tenderness and pain. We could do the same on the lateral aspect. We could go for the base of the fifth and for the navicular bone. This looks good. And we could palpate the around the ankle for tenderness at the tail of doom. And we can start further on the palpation of the tendons and other structures. For example, you can lift up your toes, not so much, just a little bit up and relax, and we find the tibialis anterior tendon. If you go here, up here, then we have the extensor digitorum, and here lift up, and they have the extensor hallucis longus, tendon. We can palpate the anterior talofibular ligament here, and the sinus, the soft spot here, and we can palpate for tenderness around the deltoid ligament here. We could check the tendons on the medial side, where we have the tibialis posterior, which is the first one, and we have the flexor digitorum, which comes here, and we have the flexor hallucis and the nerve and the arteries in the bottom here. We all often say Tom, Dick and Harry to remember, and this is also the tarsal tunnel. And on the lateral side, we have the peroneal tendons, where you can lift your feet out a bit, and we can see if it snaps over, and we can palpate for example, tenosynovitis, partial rupture, and other irritation. On the back side here, we have the Achilles, Haglund's deformity, ostrigonum. It could also be for plantar fasciitis in the bottom here. And after that, I would go for special tests. We can start with the anterior draw test. You hold the foot with one hand and places the other one on the lower part of the leg, and you bring it up like that, or like that. Anterior talofibular ligament, you try to stretch it there. We have the calcanea fibular ligament. I like to put it up in a little bit of dorsiflexion and then inversion. And the deltoid ligament, you take them there, and then I will look for syndesmosis injuries. Use the squeeze sign or dorsiflexion external there. And for Morton's neuroma, you can check the front foot with squeezing. And except for that, I think you can do the manual examination of the Chopard line and the Lisfrance line, and just go through every joint and check for fracture or joint problems and tenderness. Good, thank you.